Jake and I'm the clinician, and this is my patient Mason. First muscle, the first muscle is the tibialis anterior. The origin is the lateral tibial condyle right here. It comes down, and the insertion is the medial and plantar surfaces of the first cuneiform and metatarsal. The action is dorsiflexion and inversion of the foot. So to test it, we're going to make it plantar flex and evert. You ready? 1, 2, 3, 4, 5. Next one is the extensor hallucis longus. The origin is the middle portion of the anterior surface of the fibula. I'm going to just come down. The insertion is the base of the distal phalanx at the first toe, right here. And then to test it, we are going to put the foot in dorsiflexion and inversion. And I'm going to pull in plantar flexion and eversion. Ready? 1, 2, 3, 4, 5. The extensor digitorum longus. Its origin is the lateral tibial condyle. I'm going to follow it down. Its insertion is the distal phalange of the four lateral toes via tendons. And to test it, we are going to put the foot in dorsiflexion and eversion. We're going to pull it towards plantar flexion and inversion. Ready? 1, 2, 3, 4, 5. Okay, the next one is the extensor digitorum brevis. The origin is the distal part of the superior and lateral surfaces of the calcaneus. The insertion is the four tendons going to the first to the fourth digits. The action, it extends the MP joint to the first to the four digits and extends the IP joint to the 2 through 4. So to test it, I'm going to put the patient in extension of the first four digits, and I'm going to push against him. Ready? 1, 2, 3, 4, 5.
Okay.
The next muscle is the peroneus tertius. The origin is the distal third anterior surface of the fibula. It just comes down, and the insertion is the dorsal surface of the base of the fifth metatarsal. And its action is eversion and dorsiflexion. To test it, I'm going to push the patient in plantar flexion and inversion. Ready? 1, 2, 3, 4, 5.
Okay.
The next muscle is the peroneus brevis. The origin is the distal 2/3 of the lateral fibula. It's about right in here. The insertion is the base, comes behind the lateral malleolus and the fifth metatarsal. The action is eversion and plantar flexion. I'm going to put the patient in that, and I'm going to push inversion and dorsiflexion. Ready?
Yeah.
1, 2, 3, 4, 5. The next one is the peroneus longus. The origin is the head and upper 2/3 of the lateral fibular shaft, and it's the lateral tibial condyle. It comes down behind the lateral malleolus. That's on the lateral side of the first metatarsal and medial first cuneiform on the plantar surface. The action is eversion and plantar flexion. I'm going to push the patient in inversion and dorsiflexion. Ready? 1, 2, 3, 4, 5. Gastrocnemius. Its origin is the medial and lateral epicondyles of the femur. Comes down. The insertion is the calcaneus via the Achilles tendon. It is plantar flexion and knee flexion. I'm going to put the foot in plantar flexion and push the patient to dorsiflexion. Ready? 1, 2, 3, 4, 5. This one is the tibialis posterior. Its origin is the posterior or lateral tibia, proximal 2/3 and medial fibula. It's behind the gastroc and the soleus. It comes right here. The insertion is the navicular and the navicular tuberosity and base of 2 through 4 metatarsals on the plantar surface. Its action is plantar flexion and inversion, so I'm going to push the patient to eversion and dorsiflexion. 1, 2, 3, 3, 4, 5. Okay, the next one is the flexor hallucis longus. Its origin is the posterior distal, 2/3 of the fibula, about right here. Comes down. The insertion is the distal phalanx of the first toe, right down here. And the action is inversion plantar flexion, and it also flexes the first IP joint and assists in the flexion of the first MP joint. To test it, I'm going to put the patient in plantar flexion and inversion, and I'm going to push him towards dorsiflexion and eversion. 1, 2, 3, 4, 5.
Go.
The next one is the flexor digitorum longus. Its origin is the middle 3/4 of the posterior surface of the tibia. Comes down. The insertion is the base of the distal phalanges of 2 through 5 digits. That action is the flexion of the 2nd through the 5th PIP, DIP, MP joints, and plantar flexion and inversion. To test it, I'm going to put it in plantar flexion and inversion, and I'm going to push it towards dorsiflexion and eversion. 1, 2, 3, 4, 5.